Many of us, when we have a small skin irritation, we visit a pharmacy and buy some over-the-counter ointment and treat it at home. Skin infections don't seem serious enough to warrant a doctor's visit. But this practice of self-treating can cause more harm than good, especially in the case of fungal infections.
Fungal infections are basically infections caused by fungi, which are anywhere and everywhere, right? You could find them in the soil, you could find them in animals, right? And those are sources for humans to be actually infected. Fungal infections usually affect any part of the body that has glabrous skin. So, for example, you would have it on the hands, you could have it on the scalp, you could have it on the face. Any part of the skin that is actually moist, humid, because that's the environment where fungus could grow. No? What I find is people coming to my office with round patches and they tell me, I think it's a ringworm, right? Like that's the classic one. Unfortunately, there are many skin conditions that would have this round configuration and not necessarily they have to do with a fungal infection. Usually fungal infections, they are round or they start very small and they grow in a circular pattern, that is true, but it's not the only thing that causes a picture like that. No? Yeah. I see a lot of children with fungal infections on the scalp that are still being treated only with topical medications. So a message that I would really like to give is that whenever a physician or parents suspect a fungal infection of the scalp, the best thing they could do is to come to a dermatologist for him or her to properly diagnose and properly treat the fungal infection. It's actually not a trivial infection because at times, depending on the type of fungus that it's infecting the scalp, it could lead to very painful manifestations for the kid and even for scarring in terms of no more hair would grow wherever the fungus was there. No?
This is why Dr. Lopez strongly urges that you find out the cause of your skin irritation, especially before you start to apply common ointments and creams like hydrocortisone and triple antibiotic.
When you go to the pharmacist, which is a common practice, and they think it's a ringworm, and they give you medications, sometimes that medication would make the problem worse. And it's a little bit complicated because say they give you hydrocortisone, for example. Well, the thing is hydrocortisone is an anti-inflammatory medication. So you would feel less itching if it's itching. So you think it's working. And then you stop, and the moment you stop, we usually have what we call a rebound effect. Meaning if it's a fungal infection, it will just grow bigger, like from overnight. And then because it was working, then you continue with the hydrocortisone. Maybe you think it was not enough, not long enough or so. So in a nutshell, you would make the problem worse. So my advice, if you would like to go and do or use over-the-counters or do it yourself, whenever you have something that itches on your skin, maybe the safest way to deal with it would be to use an antifungal. And if that's not helping after 2-3 days, then I would definitely recommend that you come and see your dermatologist. No? But I wouldn't discourage greatly the practice of if something itches, start using a steroid cream like hydrocortisone or betamethasone or the famous of the dermas, no? Derma X number. No? Those are really common. But as a rule of thumb, we tend to avoid any antibiotic that has neomycin, which is like one of
antibiotic?
Exactly.
The most common?
Yes, that's the most common. Why? Because in certain people, neomycin would induce like a burn, a contact dermatitis, we call it. So it makes the problem worse. So we usually never use triple antibiotic ointments or anything like that. No.
Fungal infections can become serious and lead to further complications. As for prevention, it's important to note that fungal infections are contagious. Some basic prevention tips include keeping skin clean and dry, using flip-flops in public showers, using powder, sunning your shoes, and most importantly,
basically avoid self-treating and try to see a doctor, at least before you get any treatment.